Hi, as we are conducting many courses on psychological aspects, psychometric test on 16 PF, thematic apperception test, and Rorschach. And today we have started program on cognitive behavior therapy. Let us know what is CBT and a little overview of this cognitive behavior therapy. CBT is a talking therapy which has been shown to be effective in treating common psychological and emotional difficulties. It is also used for pain management and other physical conditions as well as relationship issues. It is based on comprehensive research evidences of what works and on established cognitive and behavioral models of how and why psychological and emotional problems develop and are maintained. So now the question is, how does it work? CBT is based on 5 key areas or elements which we know strongly influence each other and give rise to patterns of thoughts, behavior, and emotions. In all cases of psychological distress, there will be patterns of thoughts, feelings, and behavior that maintain and exacerbate difficulties and distress. Sometimes client will recognize some of these patterns, but more commonly they are not fully aware of the ones that maintain their difficulties. Now, what are these 5 interacting elements of CBT? First is the cognition. What is our cognition? Cognition is our thoughts and beliefs. Second is behavior, what we do and what we do not do. Third is the body, our physical reaction. And fourth is the emotions, that is our mood. Fifth is environment, our circumstances and relationship. You have seen that it has been represented by some circle. So many of our thoughts are actually automatic thoughts in response to a variety of triggers. These thoughts occur without us having to think about those thoughts. They just pop up and can be in the form of verbal thoughts or images. Often we are not aware we are having automatic thoughts, or we are not aware that we are having an emotional response to our thoughts. So automatic thoughts are an integral part of our thinking process, and many will reflect underlying beliefs that we have about ourselves and about the world in general. Thoughts are closely linked to our mood, and our mood is closely linked to our thoughts. If we feel anxious, we'll experience anxious thoughts, and if we're having anxious thoughts, we'll feel anxious. So if we feel depressed, we'll have a series of depressed negative or automatic thoughts, and because we are feeling low, we feel even more depressed, and so on. This process goes on. Our physical responses and our behavior also change in response to our thoughts and moods, and this in turn influence our thoughts and moods. In this interaction between the different elements that establish both the short-term and long-term patterns that maintain psychological distress, in CBT, these are often referred to as vicious circle. which is commonly termed as VCS circles. The object of CBT is to identify and change this pattern in order to secure immediate benefit and to understand how these patterns emerged in order to maintain improvement in the long term. Treatment goals directly target distressing symptoms, reduce distress, help reevaluate thinking patterns and beliefs, and promote helpful behavioral responses by promoting solutions focused interventions. Now, anybody can ask this question: is it one size fits all? No. Although we use a number of well-established techniques and a research-based understanding of human cognitive and behavioral process, CBT is tailored to the individual because their circumstances, their thought patterns, and their emotional and behavioral responses are unique. If one person has a person has a belief that they should be perfect, then they may strive to be very successful in their career. Whilst another person with the same belief may avoid applying for promotion in order to avoid positive failure. Similarly, a person experiencing anxiety in a supermarket may change their behavior subtlety, such as gripping their shopping trolley because they think they might faint, while others may run out of the shop and start to avoid supermarket altogether. Another may only shop when they know the store is not busy. In CBT, the devil is in detail, and everyone's details are unique, as are their life experiences and individual circumstances. Now let us see how the therapy is structured. What happens in the therapy? Therapy normally lasts 40 minutes to 60 minutes. Although a major component of CBT involves the client carrying out tasks between the therapy sessions. These tasks are agreed between client and the therapist and are based on a shared understanding of the problems. Together, the client and therapist identify how this problem affects thoughts, behaviors, feelings, and physical functioning and work together in order to find solutions that are most helpful than the present way of coping. CBT is generally focused on what is happening in the present, although in some cases it is useful to explore early experiences or past trauma in order to develop an understanding of how thought patterns and beliefs were formed by these experiences. However, in other such cases as phobias, simple desensitization and exposure exercises may be all that is required. The goal of treatment and the pace of treatment are determined by the client. Progress is monitored throughout therapy by the use of well-established psychological rating scale, by the attainment of specified goals, and by clients' rating of their subjective experiences. This informs therapy by identifying areas of improvement that can be built upon and problematic areas that have to be addressed further. In CBT, therapy is structured towards identifiable goals, and progress can be seen, felt, and also measured. Now, we just would like to know why cognitive behavior therapy is required. Why CBT? Mental health and emotional problems are extremely common and are the most common reason for visiting any doctor. Numbers that do not describe the misery that goes with this condition nor the impact on the lives of those who are facing these difficulties. At the base, these conditions steal time at the worst, wreck lives. So why does CBT offer a solution? Because it is effective. First is the effective. Cognitive behavior therapy is based on evidence of what works. As a treatment, it has been subject to rigorous applied research and major research reviews over the decades and has been shown to be the most effective treatment for a range of common psychological and emotional difficulties. For this reason, it is the treatment of choice approved by many international organizations like NICE, National Institute of Clinical Health Excellence. It's cost effective with treatment usually ranging between 8 and 16 sessions. If a therapist suggests that treatment needs to be long term, then you should ask two questions. First is the research evidence, and second is research evidence and also in whose interest it is therapy to be long term. And second is collaborative. CBT works on the basis that the client is the expert. After all, it is client who knows their own problems better than anyone. In CBT, the therapist and the client will attempt together to map out in detail what exactly is happening within a CBT framework, which links our mood, thoughts, physiology, and our behavior with our individual life circumstances. This formulation is a tailor-made approach which will detail both the short-term and long-term patterns which lead to maintained psychological difficulties. By a shared understanding of what is happening to maintain difficulties, goals for therapy can be agreed and the client and therapist work out the best route to achieve those goals and secure long-term change and recovery. In CBT, the client is active and much the therapy takes place between sessions when agreed tasks are practiced. The pace of this is determined by the client, not the therapist. And third important reason why CBT is required is the empowerment. CBT is about the client progressively being their own therapist on the road to recovery and maintaining these skills in order to secure long-term well-being. If you want to draw an analogy, it is about giving someone a fishing rod, not a fish to cure their hunger. It is why CBT has been shown to be effective not only in the short term but also in the long term. Mental disorders and psychological distress is not a sign of weakness. The fact that clients manage to carry on day after day despite their difficulties is testimony to their strength. As a therapist, I may act as a guide and support, but it is the client who makes the changes and achieves the goals of the therapy. This is what actually the brief overview on cognitive behavior therapy. Hope you have liked it. And I request all to like this channel and subscribe this channel so that we can understand what people are expecting from us. Thank you very much.